Welcome to NICU in a Nutshell, where we talk about all things neonatal in a simple and easy way to understand. While this isn't meant to be medical advice, it is a place for education, questions, and community. My name is Anna. Let's get started. Welcome back, everyone. We're going to be talking about some brief do's and don'ts about phone calls to the NICU. Let's jump right in. Do call whenever you want. That is your baby in the NICU, and you're entitled to call anytime you need or want. With that being said, please keep in mind that some hospitals have policies and procedures regarding when phone calls can and cannot be answered, such as sign out between the providers or your nurses. So make sure you ask staff in your NICU if they have any of these so you can set up realistic expectations for yourself and your phone calls. Don't be offended if your nurse or provider cannot come to the phone. Most likely they are taking care of your baby or another baby in the room, so feel free to request a call back or ask when a better time to call is. With that being said, do ask whoever answers the phone how your baby is if your nurse or provider cannot come to the phone. While they probably don't have all the details of your baby's day, but sometimes an all good is all you're really looking for. Don't let the phone ring an infinite number of times. Like I said before, the nurses and staff are taking care of your baby and other babies in the NICU. So if they're not coming to the phone, it's because their hands are literally full with taking care of your babies. If no one's answering after a couple rings, hang up and try back later. Do write down questions that you have for your nurses and providers. Being in the NICU is really overwhelming for some, and so writing down what your questions are throughout the day or as you're thinking of them, even in the middle of the night, can help you organize your thoughts so you make sure to get the answers that you're looking for. The same applies to when you're at the bedside. If you think of questions and the provider or nurse isn't readily available, just jot them down so we can address them at a later time. Don't encourage people that are not parents or primary guardians to call for information on your baby. Your baby is a patient in the hospital and has the same rights to privacy as anyone else. As healthcare providers, we are legally unable to give information about your baby to anyone but you. But if you want to share the information with your friends and family, go right ahead. The last do is call as much as you want. This is your baby, and you're entitled to an update whenever you want or need. Just keep in mind whatever your hospital's policies, procedures, and schedules might be, so you can make the most out of your phone calls. Thank you for watching. Please hit the subscribe to join our community, and we'll see you next time.